Good morning to one and all. I'm yours, Dr. Ravindra Kumar Arunsi, in front of you back once again with my YouTube channel SB Ayurveda Academy. So, welcome to you all for the today's presentation. As for the requisition received by my most of the students, they requested me to present with today's module related to the topic of Kamala. So, I'm here for you people to interact with the topic about the Kamala. What is nothing but the Kamalas, and what are the types of the Kamala which will comes out, and how we should understand about the Kamalas, and in different literature of Ayurveda like Brahatrayis and Lagutrayis, what they explain about the Kamala, and how we should try to understand about the Kamala from Pandu, or Pandu is itself as a type of Kamala. So lot of things are there to discuss in the topic of Kamala. So once again, welcome to all of you for my YouTube channel. Kindly subscribe with my YouTube channel SB Ayurveda Academy, and by clicking with the bell icon. So today's we have with the different words related to the Kamala, are to make the nomenclature of the disease of every diseases. There will be some exactly the nirukti will be there, as well as the definition will be there. So vyadhi namakarana siddhanta, which always follow the different type of the theories, and which always giving the particular name for the different type of the diseases. So here also the word of Kamala, which is derived by with two different terminologies, as we observed, Kaman Latiti Kamalaha. Here there is two words are there. One is called as an Kaman, another one is an Lati. That means the word of here as an Kaman, which give the meaning towards the desire, or to attract, or to appears, and in Ayurveda we can also call the another term like Icha, like a words. So these desiring things which will become into the Lati, the desirable substance which becomes into the Lati in the disease of Kamala. Lati is nothing but where the person is going to become diminished. Lati is nothing but the diminished with the desirable things. That means the person is getting diminished desirable things related to the food. Those all the word which is considered to be as an Kamala, like a conditions. So here, based on the only the terminology like diminished desirable about the food, we can call the terminology as a Kamala. Or in what are the diseases, there is an Agni-mandya or loss of appetite which is present. Those all the diseases we cannot call the term as an Kamala. So there is an vyadhi namakarana siddhanta belongs to the Kamala, which also explain based on the pradhana lakshanas. So depends on the pradhana lakshana, we are going to consider the terminology as an Kamala on here. That means in all general types of Kamala, we are observing the lakshanas like Haridra Netra Sabrusham, Haridra Tvangna Kanana, like such symptoms will be there. That means based on the yellowish discoloration of the skin, nail, eyes, there we are going to make the diagnosis as an Kamala, like a diseases. So here the definition which has been given by the Acharyas by Charaka Chikisasthana, that Pandurogittu yovatyartaha pittalani nishevate tasya pitta masridmansva dagdva rogaya kalpate. That means here we try to understand first with the two things. One, there is two forms of Kamala we are going to notice. One which is called as a Swatantra Kamala, another one we are going to call the term as a Paratantra Kamalas. So this definition which is giving the meaning as about the Paratantra Kamala. That means basically the patient is suffering with the disease of Panduroga, and that person furtherly he is inducing into the different type of the Pitta Prakopaka Ahara Vihara. Pandurogitu yovatyartha. Already the patient is suffering with the Panduroga, and that person is consuming the Pitta Prakopaka Ahara Vihara, and there this Pandurogi is converting into the further diseases that is going to consider as an Kamalaha. How it is going to convert? Based on the Pittam, Asrat, Mansa, Dagdva, Rogaya Kalpate. That Prakupita of Pitta Dosha causing the Dushti of Rakta and Mansa Dhatu, then leading into the Vyadhi as Kamala. Here we must understand with the two things. Patient is Swatantra Vyadhi is Panduroga will be there, and that Pandurogi person inducing the further Pitta Prakopaka Ahara Vihara. That means person is making the Apatyakara Ahara Vihara. There Pitta Dosha Prakopa furtherly it will take place, leading into the Dagdva. Dagdva is giving the many more meaningful words. Dagdva, which will give the general meaning as a Dahana Karma, or which is going to burn, or which is going to vitiate, or which is making into the dushti of the dhatu like asrit as well as the mamsa. So as for the contemporary sciences, we are observing a type of the jaundice which is going to called as hemolytic form of the jaundice. So in the hemolytic jaundice, majorly what we will notice, there is an hemolysis of the RBC will take place. Destruction of immature RBC leading into the hemolytic form of the jaundice. Destruction word itself from Ayurveda we can consider to be as a dagdvaha. Because of due to dagdva of that RBC, Panduroga converting into the dushti of Rakta and the Mamsa Dhatu leading into the Vyadhi as a Kamala like a condition. So one thing we understood that the Kamala can produce if not treated as Pandu. That means as a Nidanartakara Roga. First the Pandu Roga will take place by indulging the Ksharanamala Lavana Adi Nidanas. Then the person furtherly continuation with Nidana will be there converting into the Kamala, and if he not treated with the Kamala, further person is going to converting into the Kumbha Kamala or the Halimaka type of the Vyadhi. They all are called as a Nidana Artakara Roga. So here Pandu become as a Swatantra Vyadhi, Kamala become as a Paratantra Vyadhi as Nidana Artakara Roga. It does not mean that all type of the Kamalas are caused by after the Pandu Roga only. Without the Pandu Roga also, according to the Acharya Shishruta, he is trying to make the clarification, and we will discuss in detail with the furtherly. Shishruta Acharya has made that without the observation of Pandu Roga, directly because of due to the indulging the Pitta Prakopaka Ahara Vihara causes the Dushti of Rakta and Mansa, then furtherly it causes into the directly with the as a Kamala Vyadhi, that is called as a Swatantra type of the Kamala. So we must understand on here that with the indulging of Pitta Prakopaka Ahara Vihara, Pandu can converting into the Kamala one. Another, without the Pandu Vyadhi, because of due to the Pitta Prakopaka Ahara Vihara, those all we are going to study on here, those Pitta Prakopaka Ahara Vihara causes into the Dushti of Rakta and Mamsa leading into the Swatantra type of the Kamalas. Okay. So in this, there are so many Nidana which has been given by the Acharyas, by Charaka Chikisasthana as well as Shishruta Acharya also explain about different Nidana. As a cumulative, we are going to observe that some of the commonest Nidana, like there is an Kshara, Amla, Lavana, Viruddha Ahara and Nitya Bhojana. Asatmya Bhojana, they are also leading into the complication as Prakopa of Pitta Dosha. Similarly, Masha, Nishpava, Pinyaka, Tilaka, lot of Nidana which has been given. After that, Vidagde Annehe, Vidagda Avastha, that means already previously consumed food. It is in the stage of Vidagda Avastha will be there. That means Drava Bhuta of Pitta is observed, and furtherly over to that, if the person is consuming into the Mithya Ahara Vihara which are like Ksharamla Lavana, Vidagda Pitta is there, further person is consuming the Ksharamla Lavana Adi Nidana, that leads into the Prakopa of Pittas. Second, Diva Swapnam, not only a cause of all Pitta Prakopaka, there is a Kafaja Nidana also which are leading into the here. Diva Swapna, Avayamat Matmaritanamcha. These also leading into the Prakopa of Kapha as well as Vata, and leading as a phenomena of obstructive condition as an Shakasrita form of the Kamalas. And Pratikarmam tu Vashmanam Veganam Cha Vidarana. Whatever the types of Vega Dharana which has been explaining, those all has to be prevented. But the person who are making into the Dharana of all Avega Dharaniya, they lead into the Prakopa of Vata Dosha and lead into the obstructive phenomena. Kama, Chinta, Bhaya, Krodha. Here last line which is always suggested about the Viharaja Nidana and Manasa Nidana. So some of Nidanas on here is Aharaja Nidana, and Viharaja Nidanas are like Diva Swapna will be there, Maituna will be there, Vyayama will be there. They are all called as Viharaja Nidana. Last line is suggested about the Kama Shoka, Bhaya, Krodha, Shoka. They are all belongs to the Manasa type of the Nidana. So already we know that Kama Shoka, Bhaya, Dvayu, Krodha, Pittam cha Trayo Malaha. That means Kama Shoka, Bhaya, they all are lead into the Prakopa of Vata Dosha. Krodha, Pittam cha, Krodha leading into the Pitta Dosha Prakopata. The person who are indulging the excessively of these Manasa Roga also leading into the relation between Charika Dosha to the Manasa Dosha causes the Dushti of Vata Pitta Dosha and Utpatti of Kamala Roga. And another one references which is giving that Pandu Rogitu Yotartha. Already we discussed Pittalani Nishevati. That means general word, we come to the conclusion in the Nidana that what are the types of nidana which are explaining on here, all are most of them pitta prakopaka nidanas. Apart from these also, whatever the nidana which are dealt into the prakopa pitta dosha, they are all are causes into the rakta dushti and mamsa dushti causes as a pandu, and pandu as well as kamala like a vyadhis. Next slide please. So here, after indulging with different type of the nidana, how samprapti of kamala is going to be observed. So this is related to the paratantra type of the kamala. So here excessive intake of nidana by the pandurogi. That means patient is already suffering with the panduroga. Furtherly, they are causing into the nidana of ksharamla lavanadi nidana. Then here it causes the further prakopa of pitta dosha. And such prakupita pitta dosha leading to exceed into the dushti of rakta and mamsa. So dosha is, pitta is there involved, and dusha is related to rakta and the mamsa dhatu dosha. And occurrence of kamala roga, that is called to like koshta shakasrita kamala. We'll come to know what is koshta shakasrita, what is shakasrita. So generally this samprapti vigatana or samprapti chart representative about the paratantra types of the kamalas. And one more, as shakasrita kamala on here, there is an excessive intake of guru shita madhuradi nidanam. That means koshta shakasrita kamala is led by the prakopa pitta dosha. That means there is a dushti of pitta dosha will be there, and that dushti of pitta leading into the rakta and mamsa dhatu dushti. Whereas there is another type of the kamala which will come out, that is called as an shakasrita kamala. In this, not only a prakopa of pitta dosha is required, there is an obstructive mechanism by the prakopa of kapha, and obstructed vata takes the pratimarga gatita pitta to the shakagata and leading into the shakasrita lakshanas. So in this, there is a dushti of kapha dosha also is important. So diva, swapna and others are belongs to the kapha dosha prakopaka ahar. So here guru shitadi madhuradi nidana, excessive intake of then that lead into the causing excessive kapha vruddhi leading into the marga avarodha. It causes into the obstructive pathologies. After that, marga avarodha causes into the obstruction for gati of vata dosha. When gati of vata dosha will get obstructed, it takes into the pratiloma gati or viloma gati. And that prakopa of vata dosha or vilomita vata dosha, this makes further movement toward the pitta in either direction to the, that is shakagata. That means whatever the pratiloma gati of vata dosha will be there, that prakopa of or vilomita vata dosha, it takes the pitta towards the shaka region and causes the symptoms of kamala. Here what we noticed, the symptoms is belongs to the shakagata because pitta is moved toward the shaka, not inside the koshta. Related to koshta, you will observe the absency. In the shakagata, you are observing the symptoms like haridra netra sabrusham, haridra twang nakananaha. 1. Then causes the pita tvacha, netra, mutra, naka. They are all becoming into the pita varnata. Whereas mala colors will turns into the tilapista nibam. It is just like a shveta varnata will be there. Clay color like a mala is going to be observed. That means koshtagata lakshana is absent, shakagata lakshana is going to be observed. So what it give the meaning here, one side in a koshakasrita kamala, we are trying to noticing with as bahupitta kamala, there is an prakopa of pitta is going to be observed, and in second condition, in the koshta, due to the obstruction, pitta is goes on reducing, so that we are also calling the another term as alpa pitta kamala. So two mechanism will take place. You can call the term as a koshtashrita, koshakasrita or shakasrita kamala. Or also we can use the another term, one bahupitta kamala or alpapitta kamalas. Bahupitta kamalas producing into the koshakasrita, where you can observe with all haridra netra sabrusham tvangna kanana, along with the mala also become into the yellowish discoloration. Whereas in shakasrita, except mala, remaining things will becoming into the yellowish discoloration. We are going to call the term as bahupitta and alpapitta. So we'll discuss in detail with the classical references. So this is samprapti gatakas. What are the dosha which are involved? This you already know that. Here doshas are pitta pradhana tridoshas. Doshas are rasa rakta mamsa will be there. Shrotas, rasa rakta and mamsa va shrotas. Adhisthana will be coming into the tvacha, netra, naka, mutra, mala, all where you are going to be observed. Shroto dushti is sanga and the vimarga gamana. And Agni is, Mandagni is going to be noticed. Swabhava is, it may be Ashukari as well as Chirakari. Sadhya Sadhyata is Sadhya, and if it becomes Chirakari, then it will be coming into the Yapya or the Asadhya. Like Avastha, like Halimaka, the Avastha will come out and leading into the Asadhya like Avastha. Udbhavasthana is Amashivata as well as Pakvashivata. And there is an classical references which are giving with types of Kamala broadly into the two words, where we can observe according to with Charakacharya, he is giving the word as Koshta Shakashrayoho Mataha. There is two things are there. One is Koshtashrita Kamala, another one is called as a Shakashrita Kamala. And same Koshtashrita Kamala also called the term as Koshta Shakashrita Kamala, because the Lakshana is not only observing in the Koshta, you are observing with a Haridra Netra Sabrusham Haridra Twang Nakananaha. That means the Lakshanas are belongs to the Koshta also, Lakshanas are belongs to the Shaka also. So that Koshtashrita Kamala also called another term as a Koshta Shakashrita Kamala. Another one is Shakashrita Kamala. That means the Lakshana of Haridra Varnata is observing only in the Shaka, not in the Koshta. Because of due to that, Mala will become into the Shweta Varnata. Apart from that, other parts will become into the yellowish discoloration. So to make differential between Shakashrita Kamala to the like Kafajati Sara, by only using the word of as Mala Shweta Varna of Varcha or the Shweta Varna of the Mala, there is an Avyapti Lakshana Dushti will take place. Because even in case of Kafajati Sara also, we are observing Shuklam Gurum Cha like a Lakshanam. Shukla Varnata Mala will be there in Kafajati Sara also. So by only observation of Shukla Varnata of the Mala, we cannot call it as a Kamala. So in Shakashrita Kamala, what should be there? As like a clay color, Tilapishta like a color of the stool should be there, associated with Haridra Netra Sabrusham Haridra Tvangnakanana. Other part of the body into the yellowish discoloration. That means Shakagata Lakshana has to be present, Koshtagata Lakshana has to be absent. That is called as Shakashrita. If you not treated these two furtherly, then it is going to producing into the Upadrava Swarupa with another two types. They are called as Halimaka and Kumbhakamala. And according to the Shishruta Acharya, also trying to explain the similar type. One is Kamala, Halimaka, Kumbhakamala. Then there is an Lagharaka like a terminology which has been used. Another one, Upadrava Avastha. What are those? We will discuss it. According to Vagbhata Acharya, the types has been given as a Swatantra, Paratantra. Already we discussed it. Kumbhakamala, Lodara, Alasaka, like a different terms are there. So another apart from this, there is one more terminology which has been used associated with Haridra Netra Sabrusham. If the patient is presented with a Jwara and Atisara, that is called as a Lodara. One more term which is given as a Panaki. Lodara is there, Alasa will be there, Panaki will be there. Panaki word is nothing but Kamala associated with Jwara and Atisara is called as a Panaki. Like different types of the Kamala and its Upadrava has been explained by the Acharya. In that, we will discuss with one by one different types according to Acharya Harita. He is trying to explain that Pandu is going to converting into the Kamala, so that Kamala is also a types of belongs to the Panduroga only. So in this, he is trying to explain about the totally 8 types of the Panduroga only, based on Vataja, Pittaja, Kapaja, along with the, he is trying to explain Kamala Chaiva, Halimakaha, Smute, Ashte Daiva, Kalu Panduroga. So 5 types of the Panduroga plus Halimaka, so Shakashrita and Kostashrita. Totally 8 types of the Kamala he is trying to explain it. Apart from them, he is trying to explain Ashte Ardaha. That means Ashte Arda. Ashta means 8, Arda means half part of that. That is 4 types of the Pandu. That is Vataja, Pittaja, Kapaja and Sannipataja. Mrudbhakshanajanya Pandu, Acharyas are not going to explain, and it is based on Hetu Pradhanika and Vyadhi Pratyanika. They are not going to explain. So 4 types of the Pandu remaining are called as a Kamala. That means Kostashrita, Shakashrita, Halimakas are called to be as a Kamalas. This is according to the Harita. And as for the Shushruta, he is trying to explaining as Kamala as one of the Swatantra Vyadhi. He is not explaining about the Paratantra. Both are different and explained with the Hetus are with separately. Shushruta Acharya trying to explain the Nidana and its Samprapti and Samprapti Gatakas are separately by Panduroga also, and he is trying to explain about the Kamala as both are separately. Next. So Vagbhata Acharya is trying to explain on here. It is considered as a 2 different diseases occur independently in different fashion. He is trying to give some of the simile to convince us that how we should accept Pandu, how we should accept as an Kamala Vyadhi. Both are separate different diseases only. Pandu, after that he is going to say that Bhavet Piktolbanasyoho Pandu Rogadratehe Apicha. What he suggested, because of due to the Nidana Sevana, patient goes into the Pandu Roga and you are observing the Pancha types of the Pandu diseases. And if patient goes into the Piktolbanasyoho, if Pitta Dosha Prakopa further it takes place, then another type of the Vyadhi is going to be produced and its management also get differ. That is called as an Kamala Vyadhi. How we should understand from Pandu to the Kamala as a different, he goes on giving the some of the example like Pandu Rogi Ape Bhavet, Pandu Rogad Vinoti Bhavet, Yata Pramehashritaha. He is giving simile on here. Pramehashritaha Pidakaha. That means in case of Prameha, if you not treated properly as an Upadrava, you are observing with a Prameha Pidikas. That means Prameha, after that Pidika Utpatti will take place. It does not mean that all type of Pidikas will be observed after the Prameha only. Without the Prameha also we can observe the Pidika. Like that he is trying to explain. And similarly one more references has been explained by the Acharya Vagbata and here that Kasino Raja Ekshme. In case of Kasa, there is 5 types of the Kasa which has been explaining like Vataja, Pittaja, Kapaja, Kshataja and Kshayaja. And same more Kshataja and Kshayaja Kasa, if you not treated it, that furtherly it converting into the Kshaya Vyadhi. So here Kshayaja Kasa, all type of Kshayaja Kasa, it is not mandatory that they are converting into the Rajekshma. Same like all type of Panduroga, they are converting into the Kamala. There is Panduroga furtherly which makes into the Pittolbana will be there in the same Shrotas, they may converting into the Kamala Vyadhi. Otherwise they are suffering with only Panduroga. Here Pandu will become Swatantra Vyadhi. When Pittolbana will take place, there Kamala is also considered to be as one of the Swatantra type of the Vyadhi. So without Pandu also we can observe the Kamala like a conditions. So then individually while explaining with the Lakshana, Acharya as Samana Lakshana of Kamala, he said Haridra Netra Sabrisham, Haridra Twaka Naka Ananaha. In case of Samana Lakshana of the Kamala, to diagnose and to recognize is Haridra Netra. There is an Haritavarana, yellowish discoloration of the eye will be there. Haridra Twacha will be there, yellowish discoloration of the skin. Netra, Naka and Mukha Pradesha, everything will become into the yellowish. Apart from them, Rakta Pita Shakran Mishroho. Rakta Pitta Shakran Mishroho. Pitta Mishrita Raktima Varnata Purusha we are going to be observed, or the stool also becoming into the Harita Varnata or the yellowish discoloration is going to observe. That is called as an Kamalaha. Next, Beka Varno Hatendriyaha. Beka Varna is nothing but here Beka Varna is, they are giving once again the simile. The type of the color. Beka is nothing but the rainy season frog. How the color of the rainy seasonal frog will be there, like yellowish. Similar type of the color we are observing in the person who are suffering with a Kamala will be there. So that is called as a Beka Varno. Hatendriya means if you not treated it properly with a Kamala, then there is an Indriya Nasha is observing and causes into the Upadrava as a Halimaka and death of the person. Daha Vipako Dorbalyam Sadana Ruchi Karshitaha. Here Daha Lakshana will be there like Samanya Lakshana of Pitta Dosha. Daha, Avipaka, Durbalata, Sadanaha, that is Gatra Sadana will be there and Agni Sadana, both. Gatra Sadana means the person will become lethargy, Agni Sadana means Agni Manda Lakshana will observe. Aruchi, that is Anarogya will be there, and next Kamala Bahupittascha. Here Acharya Charaka is suggested with the word Kamalaha or Bahupittascha. One is Bahupitta Kamala will be there, another one will be Alpapitta is there. Bahupitta Kamala, we are going to call it as Koshta Shakashrayaha Mataha. Koshta Shakasrita Kamala, also called another term as a Bahupitta Kamalaha. Then second, Shakasrita Kamala is nothing but same Lakshana except one, that is Purisha. The stool color will, on here you are observing as Rakta Pita Shakran Mutroho. Shakrat as well as Mutras are observing into the Pita and Raktima Varnata, whereas in Shakasrita you are observing Tilapishta Nibam Yastu Varchaha Srujati Kamalihi. That means Tilapishta Nibam. If you prepare the paste of Tila seed, how it will become like a clay color, you know, that type of the color stool you are observing in case of Shakasrita Kamalaha. Sleshmanam Ruddha Margam Tam. Here Samprapti, what it suggested, why the stool color will become clay color or color will become absent, because of due to Sleshmanam Ruddha Margam Tam. Kapha dosha causes into the Ruddha Marga. Marga means our, as a Shrotas, there is a Shrotas will get obstructed and that obstructive causes into the pitta kapha harairjaye. Pitta and kapha will be coming into the nasha and producing into the shakagata. That means whatever the pitta which will be there in the koshta with the cause of kapha dosha obstruction, there is an vata dosha obstruction will take place, and that prakopa of vata dosha takes into the pratilomagati, and that pratilomagati of vata will take the pitta towards the shaka region, so that inside the shaka we are observing the yellowish discoloration, and in the koshta the color of the stool will be coming into the tilapistonibum like a colorization. Same like Haridra, Sabrusham, all the Haridra Varna will be there, Beka Varna, Hatain, all these general symptoms we are noticing in case of the Kamalas. So here, specifically Lakshanas which has been explaining. Next slide. Complication related to the types, if you not treated properly with cause of Koshta Shakasrita Kamala or the Shakasrita Kamala, then you are going to observe with two important things. One is Kumbha Kamala, another one we call the term as a Halimaka. So the word of Kumbha Kamala is nothing but Kalantarat Karibhutat Kruchrasat Kumbha Kamala. The Kumbha word which is suggested as like a Shushura Yukta Gata, that means empty vessel or empty pot. Empty pot we are going to call the term as an Kumbha. That means internally there is an emptiness will be there, and externally there is a distension will be there. So here also Kalantara, if you not treated properly with Koshtasrita Kamala or Shakasrita Kamala, after some duration back that will be coming into the Upadrava Swarupa as Kumbha Kamala. Here what you will observe, Karibhutat. Karibhutat means Rukshata. Karata is nothing but it causes the Karata of the Shrotas and lead into the Karata of the Udara Pradesha. Udara will become into the Karata, Kruchrasat. It is one of the Kruchrasat vyadhi and causes into the Kumbha Kamala. Why it is called as a Kumbha Kamala? Because internally abdomen is empty, externally abdomen is looks like a distended abdomen will be there. So that it is called as Kumbha Kamala. 1. Krishna Pita Shakrun Mutroho. Here the Lakshana is along with the abdominal distension. It is also associated with some Lakshanas. Krishna Pita Shakra Mutraha. Urine as well as the stool color will become into the Krishna Varnata and Pita Varnata. Brusham Shunaksha Manamaha. Shuna Akshaha. Aksha means Aksha. Shunakshi, that is orbital edema, what contemporary science is using that terminology. Orbital edema. Shuna Akshikuta Shota. We are going to notice in case of Kumbha Kamala. Then Saraktakshi Mukha. Sa Rakta Akshi Mukha. Mukha and everything will become to the Raktima Varnata. Chardi Vinmutro Yaschatamnati. Chardi vomiting will be there, Mutra will be there, and Purusha also observing into the Raktima Varnata. That is high colored. What contemporary is saying that there is a high colored of the urine, high colored of the fecal things, and high colored of the eye. Completely, you can say the term as icterus. There is a severe icterus symptoms you are going to notice in the conditions of Kumbha Kamala. Along with Samanya Lakshanas like Daha, Aruchi, Trishnaha, Tandra, Moha, Samanvita. First beginning with the Daha, Aruchi, Trishna as the Samanya Lakshana will be there. Tandra, Moha, Samanvita. That means there is an impairment of the consciousness. If you not treated properly with these kind of jaundices, they will be coming into the hepatic encephalopathy. When patient goes into the hepatic encephalopathy, when bilirubin crosses the high level more than 10-15 mg, there is a chances of hepatic encephalopathy, and that there is an impairment of the conscious level will takes place, and patient will be coming to the drowsy or unconscious. The Nastagni Saundhya. Nastagni Saundhya means the person Agni will become totally nasta and leading into the Kshipram hi Kamalavan Vipadyate. Kshipram hi, very quickly, immediately the person will goes into the Hanti soon. That means the person is going to die once it converting into the hepatic encephalopathy. Already Acharyas are explained hepatic encephalopathy if you not treated properly with Kumbha Kamala, and that time only. Then another one types will comes, that is called as a Halimaka. So in Halimaka, trying to explaining the word that Yadatu Pandur Varnaha Sad Haritaha Savapitakaha. That means here you are observing with a basically start with the Pandu Varnata, then converting it to the Sad Harita Shava Pitakaha. That means Pandu Roga will be there, not treated, goes into the Nidanartakara Roga as a Kamala Vyadhi. Here you are observing into the Pita Varnata, Haridra Varnata, If you not treated with a Kamala like Koshtashrita and Shakashrita, then it converting into the one of the Upadrava, that is called as a Harita, and the Shava Varnata will comes out, that is called as a Halimaka. So in this Halimaka, what is going to happen? Bala, Utsaha, Kshaya, Tandraha. Bala, Kshaya will be there. Utsaha, Kshaya will be there. Person will become totally weakness is observing it. Tandra will be there. Drowsiness always. Mandagnitvam, Mrudu Jwaraha. Agni Manda will be there. Lack of appetite will be there. Desire, in the definition I said, desire towards an appetite, desire toward consume of the thing. Here you are observing, and Mrudu Jwara, Alpa Jwara is going to be noticing it. And Strishu Aharshvaha. Strishu Aharsha means the person is not having the sexual desirable. There also get reduced in gear. Angamardascha, generalized body ache will be there. Then patient goes into the Shwasam, Trishnamcha, Aruchimcha, Brahmamcha. There is an exhaustional dyspnea. Will goes observe, excess to thirst observe, then Aruchi and Brahma, giddiness as well as impairment of the conscious level will come. So Halimakam Tadatasya Vidyat Anila Pittataha. It is mainly caused by the two dosha as Pitta Pradhana and Vata is associated to produce about the Halimaka values. Next. After discussing with all these things, we come to the conclusion that Kamala has been explaining basically with two conditions. One is Swatantra and the other one is Paratantra. And Swatantra Kamala can produce by directly Pitta Dosha Prakopata. Paratantra can produce after the Pandurogi. And there is generally with the two types, you can call the term as Koshtashrita or Koshta Shakashrita or Bahupitta Kamala, because of due to excessive Pitta it is going to observe. And second one is Alpa Pitta Kamala or Shakashrita Kamala or obstructive form of the jaundice. So these two conditions are commonly observed, and if you not treated it properly with these two, they may converting into the Upadravas like Kumbha Kamala, like Halimaka will be there, as well as you can observe another few more terminology which has been given like Panaki, Lodara, such a type of the vyadhi that is associated with the 1 month symptom. They goes on explaining like Panaki and Lodara like a conditions. Okay, so after the discussion of the Nidana Panchaka, one of the utmost important thing which will come out, and where you are interested to know about how can manage the disease of Kamala like a vyadhi. Most of the people, they will think, or generally we are observing and we are noticing in the public that whenever patient will goes with a Kamala, suddenly in either day of week or like Sunday, some people as in home remedies, they goes on giving with some Ayurveda churnas, and the people will take consuming with that churna and they feel they are improved, or sometimes they will end up into the complication and lot of blaming will come towards an Ayurveda. It is not, I am saying you, it is a proper method of Ayurveda therapy. And the practitioner who are practicing by their own, I doesn't want to comment. The treatment belongs to the Ayurveda is totally different. Depends upon by the Nidana Panchaka, depends upon by the Samprapti of the Vyadhi. We are trying to follow one theory that is called as Samprapti Vigatana Meva Chikitsaha. In individual type of the Kamala, the treatment aspect will goes differs, and we need to follow up the similar therapy which is explained by the Acharyas, not by using with a common one drug like Katiki Churna. If you given with Koshtashrita and if you given with the Shakashrita, both the patient with the same, one side you will get the reference and the other side you will not get the relief with the symptoms. Sometimes it may get aggravated also. Some people blindly they will do that, they will tie with a Chitraka in the arm and it will get reduced into the Kamala like a vyadhi. So they are all not things. Majorly we need to follow what the Acharyas are suggested. Being an Ayurveda Tadnya, and I am trying to suggest with all the Ayurvedic Acharyas and all lung-budding Ayurveda doctors that try to treat this Kamala Vyadhi depends upon by the Utpatti of Kamala, depends upon by the types of the Kamala, depends on how there is a Samprapti is formed. Based on that, Vigatana Chikitsa has to be adopted. Then only the Kamala Vyadhi goes on curing. Then same therapy, what are the Acharyas have suggested at presently. Most of the contemporary science people also trying to follow the role of Ayurveda, and where they are following, we will goes on discussing in this. So here, general line of the treatment which has been explained by the Acharya for Kamala Vyadhi is 1. Tatra Pandavamaihi Snigdai Tikshnoi Urdhvam Anulomakaihi. The Pandavamai, Panduroga is converting into the Kamala like a condition. That means Pandu as a Paratantra type of the Kamala is present. During that, we have to go for the therapy like Snigdha Tikshna Urdhva Anulomakaihi. By using with the snigdha and tikshna types of the aushadhi, we need to conduct a therapy as urdhva as well as anulomaka. Urdhva therapy means vamana karma, anulomaka is related to as virechana karma. Here it gives the two meaning. Urdhva anulomaka means through the urdhva pradesha we need to make the dosha anulomagati. Another one is which will give the meaning as anulomana is nothing but vatanulomana, which is as virechana. So snigdha, by using with the snigdha and ruksha aushadhi, we need to conduct a urdhva, that is vamana and virechana therapy. Second, sanshodhibhi mridibhistiktaihi. If you want to go for the anulomana or the virechana, what you need to follow? Sanshodhana chikitsa, if you want to adopt means mridibhistiktaihi. Try to utilize with the mrudu sanshodhana karma, not go for the tikshna virechana or not tikshna shodhana therapy. Mrudu shodhana has to be adopted by using with the tiktarasa pradhana aushadhis. And Kamalitu virechanaihi. In case of Kamala, Acharya has suggested major chikitsa is called as Kamalitu virechanaihi. Virechana chikitsa is one of the utmost important therapy in case of Kamala. Why virechana we have to give? Virechana does with the property of vatanulomana. Virechana does the about the pitta nisarana. Virechana will remove the pitta prakupita pitta dosha, and there is an avastha of the mala which will get removed from the body. Same concept the modern science is trying to follow in case of any hepatic condition. To remove the ammonium gas to obstructive condition, they are trying to utilize about the laxative, and that laxative will reduce the ammonium gas as well as whatever the starcobilinogen which is present inside the costa will be there. That pitta which will comes outside from the body, and Kamala will get reduced. Same therapy they are trying to utilize as a purgative therapy. In Ayurveda it is already said by the Acharya as virechanam, and that virechana also not tikshna virechana. Mrudu tikta yukta aushadhi virechana has to be adopted. The next, tabhyam samshodhyam koshtabhyam patyannanani dapaye. After making into the samshodhana, koshta has to be maintained by the patya annani dapaye. By using with the patya type of the proper diet, we have to maintain the koshta. Otherwise, once again there is an agni dushti and shakagata vyadhi utpatti. Shalina. So yavagu, which type of the aharas are indicated? Shali is there, yavagu is there, goduma is there, or purana yusha, and all the things in the form of yusha we need to give for the patient. Mudga, adaki, masura, jangala, mamsarasas, they all are indicated in case of Kamala like a condition. Yatadosham vishishtam cha. Here it is an important word to understand about the Kamala is yatadosham vishishtam cha. Depends on the involvement of dosha, depends on the doshika avastha, whether obstructive is there, whether only the prakopa avastha will be there. We have to analyze it, then go for tayor beshajam machare. Depends on that dosha, we need to give about the chikitsa. Beshaja has to be selected, whether only pitta is involved, their beshaja is different. Whether kapha is obstructed, causes into the shakagata of the pitta, their aushadhi is different. There is an vata and pitta prakopa will be there in the like halimaka, their grata yukta yoga, their beshaja is totally different. So depends upon by the avastha of the dosha, we have to select the different type of the aushadhi. Panchagavyam cha, which type of the grata? Panchagavya grata is there, mahatikta grata is there, kalyanaka matapiva, kalyanaka type of the grata. By using with all these grata, we have to go for snehanartham cha gratam datya. For the snehanartha prayoga, we can select of all these gratas, Kamala, Pandurogini. In case of Kamala and Pandurogi, these grata for the purpose of snehanartha, we can utilize it. And specific line of the treatment on here is, in case of Shakasrita Kamala, what is observed, Tilapishta Niba will be there. There is because of due to kapha obstructing Vata dosha prakopa and Pratilomagati of Vata taking the pitta to the Shakagata will be there. Here you need to go for major chikitsa is Katu Tikshnoshnam Lavanam Vrisham cha. In Koshta Shakasrita Kamala, we are adopting with a Mrudu Shodhanam and using with the Tikta and Rasapradana Aushadhi. Whereas in case of Shakasrita Kamala, we have to go for Katu Tikshna Ushna Lavanair. Tikshna, there is an Tikshna Virechana has to be followed because to clear about the obstructive channel. To clear about the obstructive channel, Katu Tikshna Ushna has to be utilized, and then we need to make into the clarification. We need to make about the Avarodata, Glanischa Upakramamcha. Then we need to treat with the Tikshna form of the Virechana. Then Apitta Ragam cha Kritoho. That means Apitta Raga will be there. Here, if there is an absence of color of the stool is observed, that is tilapishta nibam will be there, and that there is an vayuscha prashamanot bhave. There is a prakopa of vata dosha will be there because of due to obstruction by kapha dosha. If we clear by the kapha dosha by giving tikshna virechana, then vata also come to the anulomagati and vata shamana will take place. Swasthanam agate pitte purushe. Then pitta easily come to the kosta and it give the color for the purusha like a condition. Pittam ranjite. It make the colorization of the pitta by doing with tikshna virechana. So two concept, kosta shakasrita kamala, we need to go for the mrudubik stikta gayi samshodhani as a virechana. In case of shakasrita kamala, tikshna ushna shodhana type of the virechana has to be adopted. Nivrutte upadravasya sat purvaha kamalike videk. On that basis, we try to adopt about the kamala chikitsa. In all type of the chikitsa, only one type of virechana is not indicated. Next. So, in case of halimaka, acharyas are trying to explain some of the yoga, how to treat with upadrava swarupa of kamala, and here is one is gudichi swarasadina rasaditam mahisham grutam cha. We have to select with three things on here. One is gudichi swarasa, another of kshira. Which kshira? With mahisha kshira we need to prepare the grita. And third is sa pibe trivrutam snigdoho rasen amalikasatu. So here sa pibe, we have to advise to drink it. What are those? Trivrutam. Trivrut leha has to be selected, or trivrut churna has to be selected, and rasena amalikasyaha. Amaliki rasa has to be selected. So the reason preparation is given that you need to select the mahisha grita with 4 part, and remaining with gudichi swarasa, amaliki swarasa, and trivrut with 1 part. That yoga can be given regularly, and definitely it is going to cure about the halimika type of the vyadhi. And second, virikto madura prayam bhajet pittalani pam. By if you want to conduct about the virechana karma means here tikshna virechana should not be done, because here prakopa is vata as well as pitta dosha will be there. So go for madura prayam cha. Madura is the type of the virechana, that is mrudu virechana has to be given to reduce about the pitta as well as the kapha like a condition. And draksha avaleham cha purvoktam. Draksha avaleha has to be given. Sarpishihi maduraniti. Grita yukta sarpi can be given, that is gritapana has to be given, and madur rasa yukta gritapana can be given. And same grita can be utilized for the apana basti, same kshira basti can be utilized, and shilayet anuvasana. Anuvasana basti can be utilized with a similar type of the gritas. And those gritas are like draksharishta yoho. Based on the draksharishta you can use it. Pibet yuttuksaha agni vruddhayehe. By giving with the draksharishta, it also makes into the agni vruddhi also. Kasikam cha abhayavaleham pippalim madukam cha balam. So here what we have to do, abhaya avaleha pippali yukta maduka, that is ashtimadu, and they are all giving as a balya property. Payasya cha, that is dugdha prayunjitaha yata dosham yata balam. Depends on the rogi bala, depends on the roga bala. This yoga, if you given in to treat with halimakami, definitely you can treat with halimaka vyadhis. And what are the do's and don'ts in case of all types of kamala rogas are like virechana is indicated, and which type of the virechana depends on the roga and rogi. We have to select whether tikshna ushna aushadhi yukta virechana or whether mrudubhistikta kaihi virechana. That has to be decided, depends on types of the kamala. Snehana grita has to be utilized in making the karma for both shakasrita as well as koshakasrita. Agni karma is there, that is there is one indication which has been given. Many times people are asking that there is an chitraka moola tying inside the over the arm region and can reduce about the kamala. But I have found the reference that there is an agni karma in the left or vama kurparakata, which is helpful to treat with a halimaka type of the vyadhi. So there agni karma is indicated. Vishrama, rest of the patient. Gudichi swarasa is indicated. Then bottle guard, pinach, papaya, amalaki, wheat, milk, green gram, these all are considered to be as a patya. In case of kamala, apatyas are there, that is all nidana which has been explained by the acharya. That is ksharamala lavana, all there comes under the apatya, which is vega dharana will be there, maitana will be there, diva swapna is there, ati vyayama is there, krodha will be there, ati vamana karma, dhumapana, there all comes as all nidanas we consider as an apatya for kamala vyadhi. And there are some of the commonest yoga I have given on here. with a dosage, but I'm requesting you that these yogas whatever I'm suggesting on here, this is only for the Ayurveda acharyas, not for the common public, because common public has to understand that we are giving the medicine of these yogas with a different condition of the different types of the Kamala. In all type of the Kamala, these all yoga if you utilize means you won't get the result. So Ayurveda Acharya, they will plan depends on involvement of dosha and dosha. They are trying to give about the this type of the yoga with mentioned type of the quantity. And Anupana is either you can select with the Sukoshna Jala or Dugdha. Sukoshna Dugdha with the dosage of all these yoga can be given with 10 to 30 ml of dosage depends on the matra. And here yogas are like Panchatiktaka Grita, Drakshadya Grita, Haridrada Grita, Dadi Madhya Grita. Then there is an Katukadhyam Grita will be there, Yoshadya Grita will be there. Yosha is Trikata. Then Danti Grita will be there. So goes on observing with few yoga. Few of them they are Ushna Tikshna will be there, like Danti, Dravanti, they are all are called to be as Tikshna Ushna property indicated in case of Shakasrita, and remaining Panchatikta Grita will be there. This is indicated in case of Kostashrita Kamalas as Mrudubi Tiktakaihi. Here Panchatiktaka you can use like Drakshadhyadi Grita, Haridradi Grita, Dadima, they are all are comes under the Halimaka type of the condition. Next. Some of the Shamana Aushadhi which has been given with a dosage of 125 to 250 mg with Anapana similar with either Madhu or Sukoshna Jala. They are yoga like Namayasa Loha. This will be indicated in Paratantra type of the Kamala. That means Namayasa content of Tripala, Trikatu, Trimada will be there along with Loha Basma. When patient is of Pandurogi converting into the Kamala, best yoga is to utilize with Namayasa Loha. Then Datri Loha, which is helpful to Swatantra as well as Paratantra, both. Nisha Loha will be there. Haridra Loha indicated in both Vidangadi Swatantra Kamalas. Then Darvyadi Loha Swatantra Kamala. Shilajitu Vataka in Paratantra Kamala will be there. Icha Vedi Rasa in case of Shakashrita Kamala. Then Punarnavadi Mandura, it is related to once again Kosta Shakashrita, Panduroga, then Kamala. Then Mandura Vataka, once again Paratantra type of the Kamalas. Then Pranavallabha Rasa, it is purely for Paratantra type of the Kamala as Kosta Shakashrita Kamalas. And apart from them, there are some of the Churnas are there, and here they are called as I did compilation of all the acharyas, whatever they said with important yoga. Apart from that also there are so many yoga has been explained in different contexts by Vaishaj Ratnavali, Bharat Vaishaj Ratnavali, even in Lagutraya and Brahatrayas. Important yoga I collected for your general information and what I am using in my practice. Those yoga I given on here. Darvyadi Churna is there, Tripla Churna is there, Vishaladi Churna is there, and Mota Churnas are there. In Vati, Arogyavardhini Vati is or Arogyavardhini Rasa, you can give it, and Panchanana Vati can be utilized. And in Kashayas, list of Kashayas are there as Falatikadi Kashaya is there, Vasadi Kashaya will be there, Datradi will be there, Draksharishta will be there, Bijakarishta is there, then Kumaryasava, Lohasava. These Lohasava and others are Paratantra. Then Markandyadi, Himalaya Avastha. There are different yoga which has been given to explain of them. Apart from that, there are so many yogas which I am trying to utilizing in the practices like Vasa Gudichadi Kashaya, I am trying to utilize it. Patola Katurohinyadi Kashaya, I am utilizing it. Or Rohita Karishta, I am trying to utilize it. Particularly in hemolytic type of the jaundice, I am using with the Rohita Karishta and I will get the good result to treat of hemolytic and others. So there are lot of yogas which have been explained by the Acharya. It does not mean that only depends on the name of the yoga we need to practice of disease of Kamala. It is not at all. We have to understand about the dosha samurchana of the vyadhi, and to make breakdown of this dosha and dosha, we need to make the fermentation and combination of different type of the aushadhi which has been explained by the Acharya. Either it may be Anubhuta yoga from you, then you can treat with this Kamala with successfully. If you go with the proper understanding of Kamala first, then if we treat it, definitely we can treat with all type of the Kamala and all vyadhi of Kamalas in all stages, you will become sadhya or the yapya. If patient is belongs to the level of unconscious will be there, and even we tried giving with these yoga with Katiki Churna through the rice tube when patient is under hepatic encephalopathy, the patient has got revolted back also by treating with Kamala vyadhi. So being a Prana Visara Vaidya, you need to select what are the conditions to treat of Kamala vyadhi and when to treat of Kamala vyadhi. So this is all about the disease of Kamala and how to understand Kamala and how to treat about the Kamala vyadhi according to Ayurveda. So I will be there in front of you once again with another one more topic, whichever you have given the requisition for me. Thank you one and all.